Hey guys, tonight we're going to talk about something I read, basically a no-brainer study for me. It was in the Journal of American Medicine Neurology, and it was regarding patients that had Alzheimer's or dementia, but they were more advanced than the actual state of Alzheimer's in which they were at. And what the study was talking about actually was the causes. And the majority of patients that are older, period, let alone then we add in dementia or Alzheimer's, have secondary diagnoses that add to the confusion, memory loss, agitation associated with that. Well, if you're in direct patient care, like I said, this is a no-brainer. We know the older you get, the more conditions you tend to have, the more comorbidities you tend to have. Well, I have a new student who's interning with me, started today, and I just had to take a stop and go, oh, what's old hat for me is not necessarily old hat for somebody else. So I wanted to bring this out to you so you could see that if you have yourself, a mom, a dad, a grandma, a grandpa that is going through increased confusion, increased agitation, could it be definitely their Alzheimer's, their age, their dementia progressing? Absolutely. But you should also look at other things, such as urinary tract infections. Those are huge culprits in causing increased agitation, increased confusion, acting out like they normally wouldn't. Another one, pain. They may be in pain and not be able to get that across that they're in pain. It's very difficult if you have an Alzheimer's patient or a dementia patient to get to them that they're in pain, but that is something else to look at as well. And of course, other things like too low blood sugar can cause confusion. Too high blood sugar can cause confusion. Look at some extra outside the box things before adding medications on top of other medications that can cause increased side effects, increased drowsiness, increased fall risk before you rule everything else out. So again, like I said, like the study said, look at comorbidities, look at things going on in their life. Maybe they just moved to a new room. Hello, that's going to cause some confusion in that aspect. Look at the whole picture